Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS, and let's just continue our lectures from the UKMLA 2 Success course. Okay, and in the last lecture, what we discussed was basically the transition uh, that you should do from the data gathering to the management, and in that we discussed how to ask about the vital signs, how to offer examinations, and how to explain a particular diagnosis. Okay, and then we also discussed the first C, that is how to ask about the concerns and what may be the possible concerns that the patient have after you are done with explaining the diagnosis. Okay, now let's just move on to the management framework. And before I start off with this is like very important, because like if you go and look at the result sheet, if you just get a chance to see the scorecards, you're going to see that people score high in their data gathering, people end up scoring high in their IPS as well, but the management is the thing that is always on the compromise. And you would see that most of the people and most of the IMGs are scoring low in the management. Okay, and the sole reason is that it's not that the people are not aware of the medical knowledge or the clinical knowledge that is behind the management thing. But like it's we all are doctors. Okay, we all are practicing doctors as well, so we know what's the basic management, and that is what is expected of you, to be very honest. But we are unable to do it in a right manner. We are unable to do it in a structured way, and we are unable to do a concern centric management. That is where we lack. Okay, and that is why we are here to give you a solution. We are here to give you the right way to do the management, and trust me on this, if you follow this protocol, there wouldn't be any disease in the PLAB 2 exam that you would not be able to cover. Okay, and you would see a significant difference in your management after you apply this particular framework, and after you start applying this particular structure to the way that you're doing your management. Okay, so I've divided the management into three parts. The first is the elective cases, okay, which is the non-emergent cases, okay, in which there is no urgency. Okay, then there is an emergency cases. Okay, so there is a way to go about it in the emergency cases. Okay, and then the counseling cases. Okay, so there are three different type of frameworks that you need to have in your mind. All right, and I'll just begin each of them one by one. All right, let's discuss with the elective cases. Okay, now what I call the management framework or the management protocol is something called the IRMAS protocol. IRMAS. Okay, and this is something that I love teaching. Okay, because like the day that I developed this and the day I figured that out, okay, it helped me in my PLAB 2 exam as well when I gave it, and then I could see a major difference in the score that I got in my second attempt. And then since the data I've been teaching it, I've seen it, help a lot of my candidates of taking my mocks as well. Okay, so IRMAS protocol is something which is very important, and it's something that should be there in your mind whenever you are doing management. And if you just follow it, there wouldn't be any management pointer that you're going to miss. Okay, in the IRMAS, you can see that there are two C's that are mentioned. Okay, one C is there after the R, and the other C is there after the S. Okay, so there are two C's involved in it. Okay, so the first C was after the diagnosis. Okay, and the other C is after the safety netting. All right, so this is, yes, what the concern is, and we are going to discuss that what can be the possible concern, and what you need to ask in the I and the R and the M and A and S. Okay, so let's just begin. All right, so I stands for investigations. Okay, so once you're done with explaining the diagnosis and addressing the concerns, okay, since it's a non-emergency case, what would you do is that, okay, thank you so much for answering all my questions. I hope that addresses your concern. Now what I would like to do is that I would like to run a few baseline investigations. Okay, so there are few cases in which you don't have to name a specific baseline investigations. Okay, Like for example, if a patient presenting with chest pain, having an MI, okay, the baseline investigations would be just done for the sake of doing the baseline investigations. Okay, there wouldn't be any specific baseline investigation that would be very relevant. Okay, the specialized investigation would be more relevant. Okay, so in cases like like these, you don't need to name all of the investigations. Okay, but sometimes you may have to name some relevant one. Okay, some particular baseline investigations, like for example, in the anemia case, you want to uh, ask about the complete blood count or the full blood count. Okay, in case of diarrhea, you want to check about the electrolyte anomaly, so you may want to say that I would like to do your specifically do your electrolytes. Okay, so how you're going to rephrase and how you're going to phrase your sentence in different cases. Let's suppose if the baseline investigations are not that important. Okay, so you're just going to say that, okay, so I would like to run your baseline investigations. Okay, and that's it. Okay, but if the baseline examinations are relevant, like for example the patients with rectal bleed, so you're going to rephrase your sentence and you're going to say that, okay, Mr. Adam, I would like to run a few baseline investigations, specifically your clotting profile. Okay, or if Mr. Adam is presenting with gum bleed, or maybe if the patient is presenting with tiredness and shortness of breath, and you're thinking about anemia, then okay, Mr. Adam, I would like to run your baseline investigations, specifically your full blood count. Okay, or specifically your complete blood count, whatever you call it. Okay, so sometimes you may have to name a specific baseline investigation. Okay, but sometimes you just have to just say that, okay, I would like to run your baseline investigation, and that would really sort the issue. So many people ask me that, okay, Dr. Sarosh, what are the baseline investigations? It includes your full blood count, it includes your urea, creatinine, electrolytes, it includes your PDINR and your clotting profile. Okay, so these are the couple of investigations which we call as the baseline investigations. Okay, then there might be few cases in which you have to offer some specialized investigations. Okay, and you have to name them. Okay, you have to name them, and you cannot just get away by not naming them. Okay, like for example, drop eye in the case of myocardial infarction. Okay, any thyroid disorder may require you to ask about TSH. Okay, acute pancreatitis case that we discussed earlier on as well, you may want to offer cinema amylase and cinema lipase. Okay, beta HCG, alpha fetoprotein if you're suspecting cancers. Okay, if you're suspecting any pregnancies. Okay, and then the radiological investigations as well. Okay, you might want to run a CT scan in the patient of subarachnoid hemorrhage. Okay, you might want to get a ultrasound abdomen done in case of appendicitis. A CT scan also done in case of appendicitis. Okay, chest X-ray, very common investigation that you may offer. Okay, so never forget the radiological investigation. What a lot of people do is that they just talk about the laboratory investigation, and then they're like, okay, fine, I'm done with asking about the investigation, and I don't need to think about the radiological investigation. But in few cases, the radiological investigation also may be very relevant. Okay, so do not forget to order that. All right, so I'll give you one more very important one very important thing, since we are discussing investigations right now. Okay, so it really depends on where you are currently situated at. Okay, let's suppose that you are in the A&E. Okay, so you can order these investigations, and these investigations would be carried out then and there only, because the A&E is in a tertiary care hospital setup. Okay, and then the investigation infrastructure is available over there. Okay, but let's suppose that if you are in the GP surgery. Okay, so if you order these investigations, okay, like for example the blood tests and the radiological investigations, they may not be able to be offered at GP surgery. Okay, so even though if you're looking at patient in GP surgery and you order investigation, you would have to tell the patient that, okay, you would have to go to the nearest hospital to get these investigations done. All right, and do not make this mistake. And why am I saying this? Because most like some of the candidates, while sitting in GP surgery, they say that, okay, I'm going to get these investigations done right now. Okay, in the GP surgery you cannot get these investigations done right now. Okay, you would have to send the patient to the A&E or a nearest hospital or nearest testing facility to get these investigations done. Okay, and yes, if you are in the A&E, even if it's a non-emergent case, you can get these samples, you can get these radiological investigations done in the A&E, done in there only. Okay, so always make sure that where you are currently situated at your setting, and depending on that, phrase your sentences that okay, I'm going to get your investigation done right now. If you're in the A&E, and if you're not in the A&E, I would like to order some baseline investigations, including this, and some radiological investigations like CT scan, ultrasound abdomen. And once you have got it done from the nearest A&E, and once your test results are here, we're going to call you back again to further discuss on it. Okay, this is a very important difference, and many people don't realize that okay, that GP surgery clinics and the GP clinics do not have the facility of running investigations. Okay, so keep that in mind when you're doing the I thing. All right. So in few cases, yes, another very important thing that in few cases, if you order a particular investigation, okay, just to further show you the severity of the condition, okay, after you verbalize the investigation, the examiner may hand over you a list of lab results or test results during the station as well. Okay, like for example, if somebody presents to you with anemia, okay, and you say that okay, from the chat that we have had, you are having anemia, and maybe because of the lack of iron sources in your diet, and it's a very manageable condition. Do you have any concerns regarding it? And then after done with addressing the concerns, you talk about the investigations, okay, and then you say that I'm going to do your full blood count. Okay, the examiner may just give you test results of the full blood count showing a extremely low hemoglobin, maybe a hemoglobin of 40. Okay, so such a hemoglobin, would should raise some suspicion in your mind that okay, this is a severe case of anemia. Okay, instead of referring the patient, and instead of considering it as a elective case, it may become a emergency case. Okay, so sometimes some investigation may be handed over to you during your consultation. Okay, so you need to keep an eye for that as well. All right, great. So now let's move on to the next letter in the IRMAS protocol, that is the R. Okay, so the R basically stands for either referral or admission. Okay, so the admission needs to be offered if there are any red flags present, and if you feel that okay, there is a need to admit the patient. Okay, like for example, just the example just I shared with you, that okay, if a full blood count shows a very low hemoglobin, that's a red flag. You gotta admit the patient. Okay, or if the vitals that you did in the VED protocol, okay, let's suppose the patient is vitally unstable. Okay, let's suppose if the ECG is showing something nasty. Okay, then you may want to admit the patient. All right, but if not admission, then the UK healthcare system works heavily on the referrals. Okay, and you have to refer the patient somewhere or the other, and the referrals can be of different types. You must have learned about it in your UKMLA 1 or the PLAB 1 exam as well. There are some non-urgent or routine referrals, okay, in which there is no urgency, okay, and you just routinely refer the patient to a specialist, okay, and this is done for the non-emergent cases, okay, in which there are no red flags that are present. Okay, then there can be an urgent 2 week wait referral. Okay, this is a very famous referral pathway that is used for the suspected cancers. Okay, the urgent 2 week wait referral pathway. Okay, uh, and then you may have to immediately or the same day referral to the A&E in case of the emergency cases. Okay, so why am I sharing this thing with you? Because whenever you are saying, okay, so how you're going to like phrase it, you're going to phrase it like this, that okay, after getting these investigations done, and once the investigations of the test, or when the results of the test are there with me on my plate, I'm going to routinely refer you to a neurologist. Okay, and unfortunately, since we are suspecting that you might be having a cancer of your prostate. Once the basic investigations are there on my plate, I am going to put you on an urgent 2 week wait referral pathway where you will be seen by a urologist or an oncologist. Okay, and if it's an emergency condition, uh, so since your complete blood count is shows that your hemoglobin is very low, I would like to immediately refer you to the A&E to get yourself checked and get your workup completed and eventually get admitted under the care of the hematologist. Okay, so the referrals are like there are two things to the referrals. Okay, number one, the duration, whether it's a routine referral, it's a 2 week wait referral, or it's an immediate referral. And number two, the referral is to the specialty. Okay, to which specialty are you referring the patient? Okay, I'm going to refer you to a neurologist. I'm going to put you on a 2 week urgent wait referral pathway where you would be seen by a urologist. Okay, I'm going to send you to the A&E where you're going to get admitted under a hematologist. Okay, so the specialty is like really important. Even if you're admitting the patient, okay, if you're sitting in the A&E and if you want to admit the patient, okay, I am going to admit you under psychiatry. I'm going to admit you under cardiology. I'm going to admit you in the acute medical unit. Okay, so the specialty is like really important. Okay, so do not miss out on the specialty and the time duration. Okay, that you're choosing and the category of the referral that you're making. Okay, so that is like really important. Okay, so I and R is covered. Now let's move on to the C, the concern. Okay, a lot of people, what they do is that they're so much in a hurry of getting to the medical management that they never ask about the concern, never ask about the C2, that is the second concern. Okay, let me just put a 2 over here so that you know that this is a second concern. Okay, so what can be the second concern? Okay, after you're done with the referral admission, you're going to ask, do you have any concern so far? Okay, and the patient may just share some concerns with you, like for example the patient may be having a concern about the investigation that you just offered in eye. Okay, in the eye part, the investigation that you offered, like for example the patient may be asking for more information. The doctor, can you please tell me what are they going to do in my biopsy? Okay, doctor, can you please tell me what is the iron profile going to show? Okay, so they may have a concern about the investigation, or sometimes they may be refusing a particular investigation. Okay, like, okay, doctor, I don't want to get a CT scan done. Okay, why don't you want to get a CT scan done? Okay, then your follow up question needs to be there. Yeah, doctor, I heard that CT scan has got harmful radiation, and I don't want to get exposed to the harmful radiation. Okay, so now your priority would be to address his concern that, okay, that is completely true that CT scan does have some harmful radiation, but the benefit of getting a CT scan done outweighs its risk in your case, and it is very important for us to see what's going inside your head or see what's going inside your tummy, so that we are able to identify a potentially fatal condition and make sure that we diagnose early and when we manage early. Okay, so your entire the dynamics of the entire session would change. In your head, you would be like that, okay, I need to manage the subarachnoid hemorrhage, I need to admit the patient for NPO, and then get the neurosurgeons on board and get him for a surgery, blah. But the patient is not concerned about that. All the patient is concerned about is not getting a CT scan done. So now your entire dynamics of the session would change. Okay, you would have to counsel the patient slightly that, okay, no, this is important for you to get it done. If the patient is not getting a CT scan done, the diagnosis will not be clear. Then whatever management that is there in your head would not even matter, because the patient's treatment would not progress. The patient's treatment would not proceed. All right. So always address the concern first, and before addressing the concern, get the habit of asking the concerns that, do you have any concerns, do you have any concerns? All right, then the patient may want to refuse admission, okay, or may have some concerns related to the referral, that doctor, why do I have to wait 2 weeks? Okay, and then you would have to slightly explain that okay, so all the patient who have a suspected cancer, there is a standard guideline that we follow, that they are to be seen within 2 weeks. Okay, because of the increased load, and since cancer is something that needs to be diagnosed early, we cannot delay your referral. Okay, so whatever the concern is, okay, they may want to refuse admission, that okay, fine doctor, I'm having diabetic ketoacidosis, but I don't want to get myself admitted. Okay, then you're gonna ask that, okay, why don't you want to get admitted? Well, doctor, because it's my best friend's birthday today, and I don't want to miss it. Okay, and then you would have to, kind of convince that patient that okay, I do understand that the best friend's birthday is like very very important, and I really appreciate the fact that you are trying to maintain your friendship and all, but let me tell you that there is nothing more important than life, and as I told you, that the condition that you are having is potentially fatal. It can lead to damage of your different organs, and you wouldn't want that to happen. All right, so how about you just stay with us for a while? We just investigate and make sure that everything is all right with you. And in case if it's not all right, then maybe you can get admitted, and or ask one of your friends to video call you, so that you can show your virtual present on his birthday. Okay, concerns are also addressed, solutions are also being offered. Okay, and that is the exact approach that you want to have when you are addressing the concern. Okay, make sure that you are convincing enough. Okay, and then a patient may give you a concern that okay, how should I go to the A&E? Like for example, how to go means that let's suppose that the patient is having a chest pain. Okay, and you are suspecting an MI, and by any chance he came to you in the GP surgery, and you are like that okay, this is an emergency condition, you need to go to the A&E as soon as possible, okay, to get yourself admitted. And then the patient would say that okay, doctor, I'm on my own car, so will it be okay if I drive and then go by my own? So you're going to say that no, since it's an emergency condition, we don't want to put your life at risk, so it's better that you call an ambulance or something. Okay, so a concern can be like this as well. Okay, these are just the possible concerns. Okay, it's unlikely that they drop any other concern other than the one that I'm sharing with you, but this is what you can expect in the exam. All right, so the IR and the second concern, or the C, is already covered in a lot of detail. Okay, so that's good. Yeah. Now let's move on to the next part. That is the M. Okay, that is the medical management. Okay, and this is all to do with your medical knowledge. Okay, use this particular section, and use this thing to share all the medical knowledge that you have in your head. Okay, and this includes the medical management. Okay, that always begins from the FI2 level management and the symptomatic management. Okay, so what you're going to do is that uh, you can offer painkillers as an FI2, you can offer oxygen support, you can give IV fluids, you can pass an NG tube, pass Foley's, you can start antibiotics as per the trust protocol. um, you may want to start antidepressants. Okay, if the patient is bleeding, you may want to give tranexamic acid. Omeprazole can be given, steroids, insulin, levothyroxine, aspirin, beta blockers, ACE inhibitors in case of hypertension. You may want to put a patient on NPO. Okay, you may want to share the idea of getting a chemotherapy, radiotherapy done, or you may want to talk about the surgical interventions. Okay, so these are the possible medical managements that are most commonly encountered, and that are the things that you can be done at your FI2 level. Okay, talk about chemotherapy and radiotherapy, talk about surgical intervention. Okay, and the way to go about it is that okay, there are a few things, like for example, I'll just demarcate it for you. So these are the things that you can do it on your FI2 level. Okay, so all of these management can be done by you. Okay, but the complex management, like for example chemotherapy, radiotherapy, okay, and any surgical intervention, in the medical management part, what you can do is that you can just talk about it, that okay, since I mentioned, let's suppose that there is a patient coming to you with back pain, and he or she, not she but basically he is diagnosed with prostate cancer. Okay, so for the back pain, you can give painkillers. Okay, you can give IV fluids to the patient. Okay, that is the level of management that you can do. Okay, but since it's a prostate cancer, it would require some complex management. So what you can do is that, okay, since I mentioned that you would be put on a 2 week urgent weight referral path with Mr. Adam. So after that, you would be seen by a urologist. The urologist may want to start a chemotherapy or radiotherapy, and if the radiologists feel, they may want to do a surgical intervention in which they would be doing a procedure called the transurethral resection of the prostate, in which we'll be removing the cancerous prostate that is there in your body. Okay, so there are a few things that can be offered at your end, and there are a few things which is way above the level of an FI2. Okay, so it's important that you say that, okay, what are the specialists going to do, or what are the seniors going to do. Okay, let's take an example of MI patient coming with MI. Okay, you did an ECG, you did the trop I. Okay, you admitted the patient in your care as well, in the cardiology section as well, or in the, you retain the patient in the A&E. And as an FI2, for the pain you give morphine, for the oxygenation you give the oxygen therapy, you give nitroglycerin as well, and you give aspirin as well. Okay, and that is all you can do. All right, then you're going to talk about that, okay, what the cardiologist is going to do. And then you're going to say that, okay, so Mr. Adam, since we run some few tests like your troponin I and your echocardiogram, so once the result of these investigations are here on my plate, I'm going to take the cardiologist on board. The cardiologist will come and assess you, and they may want to put you on a long term or a lifelong blood thinner medications. Okay, and if your heart attack is a bit severe, they may want to run an angiogram, and they may want to do a percutaneous intervention in which they may enter a stent into the blocked blood vessels in your heart. Okay, and if the severity is even more than that, then the cardiologist may involve the cardiac surgeons, and maybe they may offer you a bypass surgery. But the cardiologists and the cardiac surgeons will be in a better place to talk more about it. Okay, so just share the idea. Okay, what are the specialists going to do? Okay, and this is something which is like very very important, because a misconception is being created. It is there amongst the IMG that, okay, you just need to do the FI2 level management and then you will be fine. No, that is partially correct. You need to do the FI2 level management, yes, but you need to verbalize the entire management. That, okay, after you are done with me, okay, after I have managed you at FI2 level, fine. Once the specialist is going to come, and when the specialized team is going to come, what are they going to do? Okay, so as an FI2, you should know the entire course of action. Okay, that after you are done with your FI2 level management, after you have made the right referral, okay, what is that particular team going to do? Okay, and you need to verbalize it. And a lot of people just, do the FI2 level management, and they just refer the patient, okay, as if it's a basketball that just came to you and you just passed it, and you're like that, okay, fine, I'm done with my job, great, just give me 4 on 4 in my management. But no, the complete management needs to be known, with the fact that, okay, this is my limitation, okay, this is something that I'm going to do, and these are the things that a specialist is going to do. All right, so you need to have that in mind. Okay, so that is the management part. All right, then comes the advices that, okay, you may want to give some lifestyle advices, like the DESA, like the diet, exercise, smoking, alcohol, and how you're going to do that is, okay, Mr. Adam, since you mentioned that you've been drinking more than 14 units of alcohol in a week, I would like to tell you that this is way above the acceptable limit, and the alcohol may be causing some damage to your pancreas and to your liver as well. All right, so how about you try to quit it down, and how about you try to reduce it? Okay, just a little lifestyle advice in a very diplomatic, in a very nice way. Okay, sometimes you may want to give work related advice, somebody presenting to you with stress headache, the band like headache that is there in case of stresses. Okay, so you could give work related advice that, okay, I understand, Mr. Adam, that your work is a bit difficult, and I know that you've been working late, and I know that you've been working really hard. So how about you try to take some off from your work and maybe go on a vacation to do some stress busters and try to relax a bit, okay? And then there are a few diseases in which you will have to give driving related advice. I'm going to talk about it. I'm going to teach all of those, that what are the diseases in which you have to give driving related advices, okay? So you may want to give those advices that, okay, since you have been diagnosed with epilepsy, Mr. Adam, I would like to tell you that driving for you isn't safe. So I would want you to inform DVLA and quit driving until you are seizures free. Okay. So all of those advices would come under the section of A. Okay. Then comes the S, that is the safety netting. Okay, and safety netting becomes much more relevant and much more important when you are discharging the patient home. Okay, in those cases, it's very important to do safety netting on red flags. Like for example, if you're discharging the patient on blood thinner medication, talk about bleeding. Okay, talk about pain, talk about headache, talk about shortness of breath, and in the psychiatry patient talk about risk of self harm. Okay, and how you're going to say that, you're going to say that, okay, Mr. Adam, so this is all from my consultation. If at home, if you feel any pain in your chest, or if you feel any severe headache, or if you feel that you're having some shortness of breath, or if you feel the need to harm your own self, if you feel low on mood, or if you feel extreme high grade fever, then please let us know, give us a call on the emergency number, or book an ambulance and come to the A&E to get yourself checked. Okay, this is what the safety netting is, and it is like very important, because the UKMLA 2 exam demands a doctor to be a safe doctor. Okay, you need to show the examiner, you need to show that you are a safe doctor. Okay, and it's very important. Okay, it's very important to do the safety netting. All right, now as you can see that we are done with the IRMAS, and then after the IRMAS there's another C, that is the third concern. Okay, now after you're done with the management, it's still not done. Okay, because you haven't asked the third concern. Okay, and as I mentioned that your consultation needs to be concern centric. Okay, it always needs to be concern centric. Okay, so you're going to ask about the third concern, that, okay, uh, do you have any concerns? Okay, and what can be the possible concerns? It can be any medication related concern, that, okay, can you, okay doctor, you are starting me on, let's suppose you are starting me on steroids. Okay, can you please tell me what are the side effects of steroids, because I've heard that it is a dangerous medication. Okay, so you may want to talk about the side effect of steroids. Okay, or they may have any query regarding the treatment, that, okay, doctor, I cannot stop driving. Okay, why can't you stop driving? Because doctor, I'm the sole breadwinner, and I live alone, and I do not have anyone who can drop me off. Then you're going to address the concern, that, okay, don't worry, there are public transports available. Okay, or you can ask your employer to provide you with the company's transport. Okay, whatever the solution that may be relevant at that point in time, you need to offer that. Okay, so you see, we are doing so many things. Okay, in when it comes to the management, number one, the diagnosis, the correct diagnosis in the correct way. Okay, that is going to give you 1 mark. Okay, then the IRMAS protocol. Okay, the IRMAS, that is going to either give you 1 mark or 2 marks. Okay, or depending on case to case. There are a few cases in which they want to listen to the medical management more, and there are a few cases in which they want to listen to the concerns more. Okay, and the concern, they're either going to give you 2 marks or 1 mark. Okay, depending how much concern centric they want you to be. Okay, so this is what the management is, IRMAS, and the concerns, and explaining the diagnosis correctly. What most of the people do is that they end up not explaining the diagnosis, even though they got the diagnosis right. And in the management, they just think that, okay, management is just the M part. Okay, just this is the management, the medical management, and they only end up doing this management. Okay, and the max they would do is that they may just make a referral. Okay, and then they think that okay, I have made the referral, okay, I have talked about the medical management, and I just told the diagnosis, I'll be good to go, I'm going to score 4 on 4. Unfortunately, this would only help you score maybe a 1 or 2. Okay, if you're not doing it concentrically, if you're not explaining each and everything, and if you're not explaining the I, the R, the M, the advices, the safety netting, if you're not doing all of these 5 things properly, it's unlikely that you're going to score high. Okay, so it's a very important thing that you need to remember and that you need to do. Okay, so I just hope that I have discussed and shared the IRMAS protocol, and the IRMAS protocol is very much clear in your mind. Okay, uh, there is just a slight variation. Okay, that is for the emergency cases. It becomes the RIMAS protocol, RIMAS. Okay, and the concerns remains the same. Okay, it's just the only difference is that you pick up the referral or the admission part before the investigations. Okay, and why do we do that? Because it's an emergency case. Okay, and the first and the foremost thing that you want to do in an emergency case is to basically admit the patient. Okay, so offer the admission. Okay, if the patient is there in the GP surgery, then offer a very quick and an immediate referral to the A&E. Okay, and then once the patient is admitted or once the patient is there in the A&E, then you can talk about the investigations, then you can talk about the medical management. Okay, then you can talk about the advices and the safety netting as well. Just one thing that is kind of important is that in the cases where you're admitting the patients, in the cases where you are in the A&E and you're just retaining the patient in your hospital facility, the advices and safety netting would not become very important. Okay, they become less important because usually the advices and safety netting is, as I mentioned, it's done for those people who are getting discharged. Okay, but you may just want to uh, touch the aspect of the advices very briefly, that okay, Mr. Adam, since I suspect that you might be having a subarachnoid hemorrhage, so it's probably because of the smoking that you've been doing, and so after your discharge, after you're completely fine and you're going home, we'll make sure that we give you some smoking related advices to prevent some future episodes. Okay, so in a very smart and a very diplomatic way, you would have to change your approach. Okay, the way that you're saying things. Okay, you are advising the patient, but not right now. Just imagine you're retaining the patient in the A&E and you're saying, okay, how about you stop smoking? He's going to say that, doctor, I'm in the A&E with the worst headache of my life on oxygen support. Of course, I'm not going to smoke right now. Okay, when I get discharged, then I may think about smoking. Okay, so you need to word your advices in a very diplomatic way. Okay, and in the correct way. And the safety netting, there is not a lot of safety netting when you are admitting, because eventually the patient would be there in front of you, the patient would be in your case, so the safety netting would not be there as much. But yeah, you can say that okay, uh, if you feel any discomfort, if you want to talk to us, if you want a doctor to see you, then you can call the nurse, or you can press the bell that is there on your bedside. If you feel any pain, if you feel any bleeding, if you feel any shortness of breath, and if you feel that you're unattended, then just press the bell and let us know. A member of the healthcare team would be there to assist you and would be there to help. Okay, so that is how the advices and the safety netting would slightly change in the emergency cases, and as compared to the non-emergency cases. Okay, other than that, it's literally the same thing. Okay, RIMAS and IRMAS, it's just slightly modifying it for the emergency cases. All right, and even the concerns would remain the same. Okay, good. Yeah, so we've done the management protocol for the elective and the emergency cases. Let's just very quickly go through the counseling cases. I'm going to go in a lot of more detail when we discuss the structure for the counseling cases, but just to give you an overview. So, what happened in the counseling cases is the CARMS, CARMS protocol needs to be followed, and Why is it so? Because just giving you an overview, that the counseling station needs to be very, 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 very concern centric. Okay, if you are thinking about the concerns this much in the medical diagnostics, in the history based session, then in the counseling session you would have to think about the concerns this much. Okay, and the first and the foremost thing in any counseling session is basically addressing the concerns, giving advices. Okay, that is like very, very important. Okay, and that is why this brings us to the protocol for the counseling session, that is the CARMS. Okay, the concern is given a separate level of importance. Okay, a separate degree of importance. Okay, and it's not the small c that I mentioned over here in the IRMAS and the REMAS protocols. It's not a small c, because I want to show you the severity and the gravity of the situation, that how important the concerns are. Okay, so you begin by addressing the concern. You forget about everything. Okay, referral, medical management, safety netting, anything. Okay, you forget about it, and the first thing that you need to do is that address the concern of the patient. That why the patient was here. If the patient wants to know about something, tell him. Okay, if the patient wants the reason for a particular investigation, address that. If the patient is refusing something, try to counseling on that. If the patient is demanding something, see if you can offer it, see if you can convince the patient to stop and demanding it if it's a unreasonable demand. If the patient wants to learn about some lifestyle modification, talk about that. Okay, so first of all, just address the concerns. Okay, and if you have addressed the concerns, more than 50 to 60% of your management in the counseling cases would be sorted. Okay, and then after you're done with that, then you may think about, okay, the other things that, okay, that might have been missed and might have not been, addressed when you were addressing the concern. That is the advices. Okay, you may want to give the advices first. Okay, and lifestyle advices can be there. It can be also addressed as a concern as well. But if it's not addressed as a concern, if you forgot to address and talk about the lifestyle modification in the concern section, you may discuss it in the advice section. Okay, and then once the concern addressing and the advices are done, okay, you may want to refer a patient somewhere. The patient might need any referrals, like for example in the lifestyle modification counseling, you've talked about, how important lifestyle is, how important diet is, how important exercise is, how important smoking cessation is. Okay, so you're trying to address those concerns, you're giving those advices. But you may want to make some reference, like for example, for the diet you may want to refer the patient to the nutritionist. Okay, for smoking you may want to refer the patient to the smoking cessation clinic. Okay, for alcohol counseling you may want to refer the patient to the alcohol cessation clinic. Okay, so you may have to do some referrals. All right, then the medical management, it may be there in the counseling stations. Like for example, if somebody has an endoscopy plan, he wants to know about the endoscopy, so you explain about the endoscopy and all. But if he has agreed for the endoscopy, then there might be some medical management involved, like for example, being NPO 6 hours before the procedure. Okay, giving antibiotics to prevent any infection during endoscopy. So all of these are, medical pointers and medical things. Like for example, if somebody is here for lifestyle modification counseling, okay, want to lose weight, okay, and the patient has high cholesterol. So your prime goal is to, talk about the lifestyle modification, dietary habits, exercises. But since the patient is having high cholesterol, you may want to start the patient on statins as well. So even though it's a counseling session, somehow or the other, the medical management may be there. A few aspects of the medical management may be there that you want to do. Okay, and then the safety netting part. Okay, that fine. I've counseled you on everything, but if there is anything wrong, if anything doesn't feel right, then you can always reach out to us, and then you can always come over here, and we are going to address all your concerns again. Okay, so for the counseling session is the CARMS protocol, and you're going to understand this, and you're going to, get an idea of it in much more detail when we are going to cover the counseling sessions. All right. So yeah, this is what the management protocol is, this is what how you should be ideally utilizing the 3 minutes that is there for the management. Okay, 2 to 3 minutes. Okay, and make sure that you have checked all the boxes, make sure that you have done all of these things correctly, and trust me on this, if you are able to do all of these things correctly in the right order, it's unlikely that you score less than 3. Okay, minimum 3 you would definitely be scoring in the management, and 3 in management is a very good score. Okay, is a very very good score. Most people end up getting just 1 or 2. Okay, so I hope that I have covered the management framework in a lot of detail. Before the end of this lecture and before we move on to the next lecture, I would just like to share with you that if you've got any questions and any queries regarding the management framework, then please reach out to us in the comment box. Our contact details are mentioned below on the page. Okay, you can reach out to us on our social media on the contact number that is provided. And if you want to book a personalized mock, then please share the QR code and so go to our website, fill in a Google form, and then our team will contact you to schedule a one-on-one mock with us. Okay. So with that, I'll take your leave, and let's meet in the next lecture.